This program has been paid for by the sponsor and does not reflect the views of PCN.
Welcome to another edition of PHRC Speaks, Fair Housing in the 21st Century. I'm your host, Adrian Garcia, Director of Enforcement for the Pennsylvania Human Relations Commission. Let me start this program today by stating the obvious. We're experiencing an enormous housing affordability crisis. Some would say it's the worst in our history. The cost of housing continues to rise, but wages do not, creating a perfect storm for increased poverty and homelessness. As I'm sure many of our viewers can attest to, many live with having to make the choice between medication and meals. Add to that the additional barrier of a disability, which in many cases limits the ability of earning wages that would allow them to sustain a decent standard of living. According to the 2021 Current Population Survey, about 12% of U.S. residents ages 15 and older live with a disability, or about 39 million people across 32 million households. Thankfully, there are advocates like our guest today. Marlene O'Leary has an extensive background with several decades working in social work, psychiatric, dual diagnosis, aging, homeless programs, and disability services. Currently, she works at Disability Options Network as the director of the Center for Independent Living. This position provides an avenue for Marlene to share her passion with others in providing appropriate resources and fostering networking with other agencies and staff. Marlene graduated with her undergraduate degree from Duquesne University. Regis Charlton was born with spina bifida. Regis has a bachelor's degree and a master's degree in special education from Slippery Rock University. Regis is the deputy director for the Disability Options Network, the Center for Independent Living for Allegheny, Armstrong, Beaver, Butler, Lawrence, Mercer, and Westmoreland counties. He has worked with people with disabilities and their families as a developmental specialist in early intervention and as a behavior specialist consultant mobile therapist. Regis is a licensed behavioral specialist in Pennsylvania and has over 32 years of experience working with people with disabilities to achieve their personal goals. Welcome to PHRC Speaks, and thank you both for being with us today.
Thank you.
So, I always ask our guests, because I think it's important, but talk to me about your social justice journey to the field of disability advocates. And Marlene, why don't we start with you? Sure.
So my journey has been that of a life experience. I was not born with a disability. I do have scoliosis, which is curvature of the spine. And as I've aged, it's kind of reared its ugly head in many different ways. So my journey has really been more of the life experience. Reg, I'll let you comment on your journey at this point.
My journey, I got started when I realized that I was different and that I needed to have a different education than the people that I was in with, because I was in a special school till I was about age 7. And that is when the laws started coming to be about for kids to be included in regular education if they could be. So I was one of the people that benefited first from the law. So we're passed to do that. I've always had a passion since then to help people with disabilities, either that were like me or that possibly had other disabilities, which made it difficult for them to do other things. I did go to college at Slippery Rock for my bachelor's and my master's. During my bachelor's degree, I was drawn to a support group for disabilities called Unique Students, which supported groups for disabilities at SRU. Not only did we do support, but what I really liked about the group is that we did kind of like advocacy and educational things. We would be asked to present, and we did presentations at classrooms in the bachelor's and master's level courses for not only special education, but elementary education as well. One of the things we did that I thought was kind of neat is myself and the president of Unique Students, because I was vice president, we got funding to go to a Learn to Ski clinic at Hidden Valley. And then we produced a video for the university to use as training so they could show that people with disabilities can do other things, and we want to do those things. Currently, I am at Dawn. I'm a member of the Right to Education Task Force in Allegheny County. I was a member of the Health Coalition for People with Disabilities in Allegheny County. I am part of the Alliance for Transportation Working in Communities. I'm a current member of Oakland for All, and I do person-centered counseling services. And I was also appointed by previous executive director to be on an advisory council for the PHRC for the Penn Hills area.
Excellent. Thank you so much. And I appreciate your service to the community. So, Marlene, let me ask you this. What do you believe, or what should our audience know about Disability Options Network?
Well, Disabilities Options Network is the Center for Independent Living, as you said previously, for Allegheny, Armstrong, Beaver, Butler, Lawrence, Mercer, and Westmoreland counties, which takes in a large component of those 7 counties within the state. We are a nonprofit, consumer-controlled organization that serves people of all ages with any type of disability. Our mission is to empower people with disabilities to live as independently as they choose. And in part of that, the Center for Independent Living, otherwise known as the CIL, CIL, is the heart of the whole organization. It was founded to be exactly what it says it is: people with disabilities providing assistance to those with disabilities. So all of my staff, including myself, at 100% are people with disabilities. We bring with us a unique understanding of when we get a phone call, how difficult it is at times with just day-to-day tasks. The main core of what we provide are 5 core services. And these are free to anybody with a disability. So we do not charge people, bill insurances, talk about money. The only time we're talking about finances is if it is affecting where we can look for resources for them. So we start out with advocacy, which is our main function a lot. And that's helping people negotiate and speak for themselves. Peer support, connecting people with similar life experiences to each other. Skills training, providing guidance and support to learn new skills and refresh existing skills. Information and referral, otherwise known as INR, is also a large component of what we do. So we're going to, at that point, advise and assist individuals to access services and useful information that's pertinent to them. And then transitioning, and we have a program called NHT, or otherwise known as Nursing Home Transition, where we look at transitioning people that have been institutionalized in a nursing home back to the community and supporting these people to live independently as they choose. And also any other transition event in a person's life. And that can be transferring from childhood to adulthood, school to college, college to work, or school to work life, kind of really just helping families navigate the journey to adulthood and careers, which, as we know, can be a huge undertaking for even with those without disabilities. So compounded with a disability has a little bit of a different challenge.
Yeah, I mentioned that as we opened up that, you add this housing affordability crisis and the lack of inventory and the lack of accessibility, you add the disability to that, it compounds the problem. So my question to you is, what do you believe is the greatest obstacle faced by your clients?
Well, I would have to say that is the housing discrimination And I know we talk about the Fair Housing Act as it was amended in 1988. However, it covers all different levels of housing, including private housing, housing that receives federal funds, state and local government housing. The issue here is that oftentimes people with disabilities have to pay more when they have less of an income for housing, and that's just purely related to their disabilities. These discriminations that we see are usually based on they charge higher deposits to cover reasonable accommodation fees, disallowing service animals and emotional support animals in an apartment or housing complex, refusing rent to specific units based on assumptions about someone's disability, stereotyping people with mental illness, which is also considered a disability, and affordable housing shortages and housing crisis that have made the real estate market a daunting industry for millions of people, not only those with disabilities. For 1 in 4 people with disabilities in the United States, who must also prioritize housing accessibility after availability, this becomes a barrier to independent living, which is why we often see people with disabilities coming back to their family and living with them, because it's very hard to find independent living that's affordable. Only half of the American homes currently meet accessible standards. Nationally, 9% of these households have at least one person with a physical disability reside in this accessible home, and only 20% of accessible houses are occupied by someone with a physical disability. So basically, people with disabilities learn to adapt whatever they can in their apartment or housing. It's really difficult when you're looking at this, because this leads to unsafe situations where, injury can occur, stress, physical strain to try to reach something they cannot reach, and oftentimes even homelessness. Barriers for people with disabilities in the housing market begin before we even talk about interacting with mortgage lenders or landlords. The initial obstacle for people with disabilities is financial stability. Oftentimes, living on an income of $1,000 or less a month is very challenging in order to find housing that is safe, adequate, and accessible. People with disabilities, and this is usually adults, experience twice as likely the amount of homelessness than those that are non-disabled. And that's huge if you look at that statistic. And how difficult is it to live homeless with a disability, let alone be housed with a disability? And that's related to lower wages, fewer job opportunities, and inadequate Social Security supplemental income. So again, it bases around the ability for financial strain, as well as being priced out of the market because we can't afford places that are in safe environments. And this statistic kind of blew my mind. There are only 15 affordable, accessible units per every 100 households in need. And the property is typically some of the most competitively priced out there for people to get into. So we could adapt things to be accessible for people, but again, is another cost effectiveness. Oftentimes, when we look at rules and regulations and we ask for, a modified bathroom or a walk-in shower so someone doesn't have to struggle to get in and out of the bath and they can do it independently, we've been told that once we find the funding to put that in, that if they live in a HUD or subsidized housing, oftentimes after they leave that unit, whether that be by they pass away or they're moving to a different level of care or to a different housing situation, that has to be restored back to where the person got it before they did the modification. So not only is that money to acquire for a modification, it's also giving money back that we just put something in that we find hard to believe wouldn't be beneficial to anyone. So the other thing are, landlords often deny accommodations because of the financial cost. And oftentimes places that we do through our information referral sources will deny providing finances to help, like with a home modification, because the landlord doesn't, or the person doesn't own the housing unit. So then you have to go to the landlord and get permission, and then that leads back to what I just said. Sometimes things need to be restored in their original sense. So the problem there is, again, we're spending money and we have to get permission from multiple people in order to get the money to make this accommodation. And as you can tell, none of this happens overnight. Everything we do in housing is a process, and it is a lengthy process at times. So when we have people being evicted tomorrow, chances are they're looking at shelter living or living with someone that they know or a natural resource.
Sure.
So again, I just bring up that this is probably the hardest time it's been for housing and trying to find appropriate housing for people in safe areas. And I will stop at that point because I could just kind of go on and
Sure.
on. But, it's a challenge just to find housing, let alone a challenge to find housing with a person with a disability, with limited income, and resources sometimes.
Sure. Thank you. Thank you. And Regis, I noticed that on your website you provide fair housing training. So my question to you is, do you do this on your own, or is this in partnership with a fair housing organization? And the other part of this question, why is this, and I think we heard a little bit from Marlene, but why is this so important to your work?
So we do provide training on an individual basis. Sometimes we partner with fair housing. Sometimes we just work with the consumer individually on what their rights are, what they can do, those kind of things. We want people to know what their rights are and to be able to advocate for themselves and feel confident with it. And it's our jobs as advocates, if they're not ready to do that yet, to stand with them until they're ready to do it by themselves.
Sure. And I also noticed that there's part of your program that is dedicated to building homes with accessibility. Is that correct? And so I wanted to ask, what are some of the obstacles that are related to that as you're looking to build homes? Are you having issues with variances for disability and things of that nature?
Well, fortunately, we do not have any obstacles, barriers, and it's because the community is very receptive to working for us, because they understand that we're trying to provide homes for people with disabilities, but also we're improving the community. When there's property that's blighted or in need of a lot of repair and it's vacant, often what will happen is they'll sell it to us for $1. Mm-hmm. And we also have a land bank that we can get money from and all that kind of stuff, loans, and get a mortgage for somebody. We identify a person with a disability before we even build the home or rebuild it. And we prepare them to be a homeowner. And if they have issues with credit, we have a person that's her whole job is to do that, dedicated to do that. They end up with a house with a garage, 2 bathrooms, 1 accessible, 1 for somebody without a disability in case that's one of them. And usually in the Newcastle area. And really, they get it at a fair market value. So they're getting a house for maybe like about $50,000, $55,000 that really we put about $120,000 into.
Mm. And so how many homes have been built under this program?
Yeah. Currently, we've built 13 and sold 13. they're sold. The people are in them, and right now we're building two in the process.
Okay. So you kind of answered this, but I always like to harp on this question because I have a keen interest in it. Have you seen any exclusionary zoning practices that affect your clients and your mission?
No, we have not. With the houses we build, especially because we're building homes, the whole community, including local government, realizes that we're trying to improve the community. And even when we get a property that we feel isn't going to work for us, what we do is we offer to sell it to the person that's next to it for fair market value. And if we can't do that, we turn it into a community garden.
Okay, very good. So you also have a children and youth education program. Why is this important to your mission?
This is very special to me as an educator. We want youth to be able to advocate for themselves. We want to educate them on their rights as people that have a disability. We want them to know that independent living is making choices for yourself, not necessarily doing everything for yourself. And I personally believe it's a privilege and responsibility as advocates that we steer youth toward compassion and enable them to understand the power of diversity. We need to empower others to find their voice and use it to seek justice for others who may still not have a voice or the opportunities to do that.
Wow, and obviously both of your leadership in that space is key to that effort. So I congratulate you both on doing that. Now, Marlene, you talked a little bit about the nursing home transition that Disability Option Network has. So explain to our audience a little bit about how that works.
So this is a unique program. It's relatively new, of a few years. We work with MCOs, which are health management organizations or managed care organizations, and places like UPMC. They have a whole division on looking at getting people from in a nursing home back into the community. So if you qualify through the UPMC program and you have this certain type of insurance, they will, and this has been said, I would like to leave here. They go ahead then, and the nursing home will contact the nursing home transition coordinator through our services. What they do is, one, we're going to make sure that this person is transitioning type of individual. So we're not going to take somebody that has a really high level of care and do this with. However, that does not mean that we would not consider it, because it's a matter of just setting everything up prior to moving. So with this, UPMC will offer people amounts of money up to $6,000 or more to look at getting them reestablished in the community. Because if you've been in a nursing home for several years, you pretty much lost everything that you had, because you can only take maybe a chair with you and a picture of your family. Other than that, everything else is pretty much in that institutional setting. So what we do is we meet with the individual. Now, keep in mind, the core of everything we do is through that individual's eyes. So our consumers really are running this. So when we talk about what do you need, and we go through the list of things. Now, we need a couch, we need a chair, we need a bed, we need a refrigerator. Does the unit have this? We also have to locate the unit that's good for this person. So we're asking them, what part of town do you want to live in? Is there any certain restrictions or accommodations we need to make for you? Do you know what they are, or do we need to explore that together? So there's a lot of preliminary work before a person comes out of a nursing home. It could be months before they transition back into the community. After we purchase the items with the consumer, and a lot of this is done online because we have the opportunity to do that now, and we take the money from the budget that we're given from the providers, pay those, get it set up in the apartment, get the movers, get everything in. have them come and look at the apartment. We're going to take them out of the nursing home to look at the unit prior to doing all this work. Once they say it's okay, then we start that process. There's also monies available tied in here, and we really didn't touch on this too much, but the first month's rent, security deposit, and often the last month's rent. So sometimes we're looking at a good $2,000 up front just to get in the front door of the unit. So that's all part of the program. And there's sections for that within whatever company is providing the funding. So it could be there's a furniture funding or accessible or needs, as well as then those, frontline monies that need to be available for the security deposits and things like that. Then there comes the services. Do they need in-home services? And what does that look like for them? Do we need to apply for in-home waiver services through the state? That can also be a process. But Regis alluded to, we do have a person in our organization that has been very successful with a high rate of approvals very quickly. She's been doing it for probably 20 plus years. So she's able to help with the waiver services as well as the provider that's providing the funding. Once we get all that in place, the consumer then picks whatever company they are looking for to provide those in-home services. And then the day of discharge comes. We actually pick them up, take them to their apartment, give them the keys, get them acclimated, groceries and everything. So day one, they're set up and it's set up to not fail. Then there's a follow-up for the next 3 to 6 months from the nursing home transition team to make sure, did we miss anything along the line? Or do we need to add anything? Or is this person going along just fine? So we're going to keep check on them for about 6 months or more. If there are problems, then we can revisit back to the MCO and ask for additional funding if needed. So that's the nursing home transition in kind of a nutshell. It's a pretty unique program, but again, only to certain individuals that have that type of insurance that provide that.
Understood.
I suspect that in the near future, we may move into more companies wanting to provide that. But it is a delightful experience when you can hand someone keys that hasn't had keys in their hands for years to open that lock. You can only imagine how that feels.
Absolutely. Well, I want to thank you both for being on PHRC Speaks. I am proud of the work that you do. Where would we be? Where would this community be without you advocating in the manner that you're doing? So thank you so much for the service you're providing and for being here on PHRC Speaks.
You're welcome.
I also want to thank you for joining us on PHRC Speaks, the viewer. You could have been anywhere else and you chose to be here. For information on this topic, or if you believe that you've been a victim of discrimination in a housing transaction, you can visit us online at www.phrc.pa.gov or call us at 717-787-9780. We're also pretty easy to find online on Facebook, X, Instagram, and LinkedIn. That's going to do it for this edition of PHRC Speaks. Until next time, take care, be good, and be fair to each other.
This program has been paid for by the sponsor and does not reflect the views of PCN.